The graduates rejected as not convincing the Ministry of Health and Social Services' reasoning of budget constraints for delaying the commencement of their program. In a letter addressed to the Executive Director, Penda Ithindi, the graduates argue that the Ministry's claim of financial constraints do not hold water, given that budget allocations for January, May and September intakes should have been planned in advance in the 2025-2026 budget. The graduates also disputed the Ministry's position that intake only happens in January, May and September, pointing out that in previous years, intake had been done in March and June as well. Concerns raised in the letter include the professional and personal impact on interns, with some forced to take unrelated jobs such as working in shops and security services. They also highlighted the effect on their professional development, saying that medicine is a practical field that requires consistent exposure. The interns also raised mental health concerns, saying some graduates were experiencing stress and depression, with a few at risk of self-harm due to the uncertainty surrounding placements. They requested that internship commence on 1st of November this year to align with hospital rotations and reduce pressure on the health system. Responding to the concerns, Ministry of Health spokesperson Waldus Kamaya confirmed the delay was primarily due to financial constraints.
In line with the established structure of the internship program, rotations are scheduled to commence only in January, May, and September of each year. The program cannot be initiated in the middle of the rotation. As such, the ministry would like to communicate that the earliest commencement date will be January 2026. This adjustment has been necessitated by both financial considerations and the operational structure of the internship rotation system.
Kamaya stated that the earliest possible commencement date would be January of next year. Emil Sabeb, NBC News, Windhoek.